Your doctor is recommending an endoscopic study. Why does your doctor want you to have gastrointestinal endoscopy? Your GI or gastrointestinal tract is basically a tube that extends from your mouth to your rectum. The GI tract includes your mouth, esophagus, stomach, duodenum, small intestine, and large intestine or colon. Each of these areas can be affected by many diseases. Some of these diseases can cause pain like ulcers in the stomach. Some of these diseases are painless but can be very dangerous, like cancers in the colon. X-rays and ultrasounds do not show the inside of the GI tract very well. An endoscopy allows your doctor to see inside your GI tract. Endoscopy can also be used to obtain tissue samples from the GI tract. Seeing and sampling will help your doctor diagnose or rule out many types of diseases. How is GI endoscopy done? An endoscope is a long, thin, flexible tube. Inside the tube are fiber optic cables. Fiber optic cables allow light to pass the length of the endoscope and then transmit an image back to a video monitor. With endoscopy, your doctor can see inside your GI tract without surgery. Because the GI tract is basically a tube, it is easily studied with endoscopy. Upper endoscopy starts at the mouth and passes into the esophagus, stomach, and duodenum. Lower endoscopy, or colonoscopy, starts at the rectum and passes through the colon. Are there any risks with GI endoscopy? The endoscopy itself has almost no risk. The tube is flexible and easily maneuvered through the GI tract. Sedation is used for your comfort. Sedation does have some risk. If you're too sedated, you could have trouble breathing. And any kind of medicine has a chance of causing an allergic reaction. With colonoscopy, air is sent through the endoscope to dilate the colon. This allows for better pictures. This can cause a sense of bloating, mild discomfort, and gas after the study. Sometimes tissue samples, or biopsies, are obtained through the endoscope. These are generally very small and shallow samples, but there is the very slight chance of piercing the wall of the GI tract. This could cause serious infection and need surgical repair. Bleeding is also a small risk with biopsies. What precautions are taken during GI endoscopy? When you are sedated or helped to sleep with medicine so the procedure can be done, your heart, blood pressure, and breathing are continuously monitored. If you go into too deep of a sleep, oxygen can be administered and medications can reverse the deep sleep immediately. Your medical team is also ready to address any allergic reactions. Bleeding and perforation from biopsy are avoided with careful technique and detailed knowledge of the GI tract. Are there any alternatives to GI endoscopy? There are some radiographic procedures that provide limited views of the GI tract. They are not as thorough as endoscopy. Also, they don't provide the means for sampling tissue in the intestinal tract. If you are concerned about your GI endoscopy, discuss your options with your doctor. What do you need to do to prepare for GI endoscopy? To see well inside the GI tract, it needs to be clear of food, fluids, and in the case of the colon, poop. If you're receiving an upper endoscopy, you cannot drink or eat for 8 hours prior to the procedure. This allows time for all food and fluid to pass out of the stomach and duodenum. If you're receiving a colonoscopy, depending on your age and doctor, you'll be given pills or a drink that usually cause diarrhea. This is done the day before the study, and you can't eat again until after the study. Do you consent to having GI endoscopy? While there are rare but serious risks with GI endoscopy, your doctor believes the information gained from this procedure far outweighs the risks. Now that you understand why GI endoscopy is done, how it will be done, and the possible risks and complications, your doctor needs your consent to proceed.